Welcome to the VCA Voice Podcast. I'm your host, Dr. Marie Kerl. Join us as we dive into inspirational stories about our caring and capable associates and their commitment to guiding healing journeys for our patients. Our discussions explore the important ways VCA Animal Hospitals proactively supports the future of veterinary medicine through leading the industry in medical excellence and providing hometown care to our communities. On today's episode, I'm happy to welcome Dr. Melanie Hnot. Dr. Hnot is a diplomate of the American College of Veterinary Dermatology, and she's a staff specialist at the VCA Hollywood Animal Hospital in Hollywood, Florida. Hi, Dr. Hnot. How are you today?
I'm great, Marie. Thank you so much for having me on.
Yeah, I'm so happy that you could join, and I know people are going to be really excited to hear about skin, and you're the expert, so we're going to jump right in. Tell me a little bit about your journey in veterinary medicine and how you got to where you are today.
I have wanted to be a veterinarian ever since I was a little girl. My parents were like, you were in kindergarten and we thought you were going to grow out of it, and you never grew out of it. And so my journey has kind of been fun. Initially I thought I wanted to be like a food animal or equine veterinarian, but I really fell in love with small animal medicine. And it really wasn't until vet school that I really learned that I loved dermatology. I am such a visual person that seeing the skin changes and how they are, coming from, changes within the immune system inside the dog was really appealing to me. And it really makes a big impact on the pet's quality of life. They're waking people up at night and then seeing how happy people are when their pet's feeling better, their quality of life is better. It's something that I've really, really enjoyed. After vet school, I had 2 internships, a rotating internship at Red Bank Veterinary Hospital and a small animal dermatology internship at multiple hospitals in New Jersey and Pennsylvania. And then I moved on to Ohio State, where I had my residency and my master's.
Oh, excellent. That's a wonderful, wonderful program.
It is. I love it. I love my mentors there. And my journey to sort of Florida, become a dermatologist in South Florida, was that my family moved to Florida. And so I wanted to be near them. And of course, I love warm weather.
So I'm assuming that you're still in the same position that you took after you became a specialist. Is that right?
I am. I've actually been here for 9 years. I was thinking about the other day. 9 years was like the beginning of August. And I think something that really attracted me to this VCA in particular was the people. I love a lot of my colleagues. A lot of the same doctors are still here. A lot of the technicians. It's a hybrid hospital. So it's a specialty hospital in addition to having like general care. And that creates such a collaborative environment all the time. We have this big giant office where we're all, it's sort of like this big brainstorm of ideas for different patients. It's really fun. I'm literally learning new things all the time from everyone else.
Well, and dermatology is a specialty that really touches all other specialties and general practice. I think skin issues are either the first or second most common reason that people go to their primary care veterinarian. Is that right?
That is so very true. They're very, very common. Even with our emergency service, we see pets come in with hot spots, severe skin issues, ear infections all the time, and primary care as well.
In addition to managing your clinical patients, what science disciplines are important areas of study for veterinary dermatologists? I know that you mentioned immunology earlier, so tell me about that because it's more than just looking at skin.
It really is. And part of my master's, we had a graduate level immunology course, histopathology, getting different slides with tissue sections from the skin and being able to look at those slides, look at the different patterns of inflammation and try to come up with different diagnoses for these patients. That was even part of our board exam. It's very, very important. And what that means now is that typically, we send the pathology out to different pathologists, but when we get those pathology results back, we can actually look at their microscopic description of the different cells and kind of see this definitely fits with that disease. And also there's elements of internal medicine too. Think about different endocrine diseases. I think skin sort of has a little foot in a lot of different areas. And I think that's also a super fun thing. I definitely collaborate with a lot of our other specialists here as well. I mean, even surgery. Down here in Florida, we get some weird infections. Mycobacterial infections are these deep bacterial infections within the fat that can create these horrible lesions in kitties. Oh. And so I work with our surgeons a lot to get me really deep tissue samples because then I get really good culture results. So it's just while skin, it's the largest organ in the body, but a lot of different body systems really do affect it.
Absolutely. Absolutely. Before we move on to some of the other questions, I'm going to circle back around to your hospital. So you're at VCA Hollywood Animal Hospital, and Hollywood has a very long history and has been a training hospital for a long time. How involved are you in the teaching aspects of your hospital program?
I'm very involved, as are really every doctor at the hospital. We have, our current intern class, but every year it's sort of sad. Like, I love seeing new interns, but it makes me so sad when they leave.
Yep.
You really get to know them over time, and you sort of get to see them shape into this like new veterinarian with all this new information that they're learning. But it's a very collaborative approach. Like, in our interns see emergency cases. And so if they have a skin case, they're always like, hey, can I run this by you? And so we really we kind of, if it's just in the treatment area, we sit down and we talk about those cases. We also have a lot of rounds. So every week, like, different specialist talks about a different aspect of, of their field with the interns. Something that started really new this year with our intern director is that each of the interns sort of has their own task. One actually picks an article related to a topic. Then the other will pick a case that they've seen based off of that. And another will pick like a book chapter. And then they sort of like all come together and talk about it. And then the specialist, they sort of collaborate. So it's a really fun environment for learning. So we're very involved with the different interns. I think it's very special.
Talk to me and share with our listeners an overview of different types of skin conditions in dogs and cats that would be referred to you.
I see a wide variety. I think the most common thing that I see are pets with allergies, and allergies can present as, itching, ear, skin infections. Those are, I think, definitely by far the most common thing that I see. I always say it's like, there's not a day that goes by without a Frenchie, or it's like, it's like, there's no sunshine if there's not a Frenchie
Many
that day.
specialties could say that.
Probably. I really love seeing them. But other things that get referred to me are autoimmune skin diseases, where these pets have, sometimes more severe skin issues, crusting, around their eyes, their mouth, their ears, even their paw pads can be affected. Even some of these can be more like metabolic conditions, like hepatocutaneous syndrome, where there's a primary liver issue that is affecting the skin. That's not as common, but really anything from allergies all the way to autoimmune, and then sometimes even skin cancer. Cutaneous lymphoma. Luckily, we don't have to see that very often. And sometimes that can be really very severe. Hair loss, really flaky red skin, sometimes even like these really angry nodules all over the skin. And that always makes me a little bit sad to see that.
How often are bacterial infections a part of the underlying skin infections that you see?
Oh my gosh, Marie. Literally every patient I see pretty much has a skin infection. I'm always like telling my technician or whoever is helping me, I'm like, make sure you put on some gloves, because sometimes you don't really know what you're getting into until you start looking at the pet. But bacterial infections are one of the most common things I see. And more commonly now, we're seeing antibiotic resistant infections.
Oh, wow. Okay.
Literally every week I get multiple cultures back. So I think good antimicrobial stewardship is becoming really important in veterinary medicine, and especially in veterinary dermatology, where, we do use oral antibiotics, but we also focus a lot on topical therapies to really try to help these pets as well.
Well, that segues into my next question. And given that skin diseases are so common, and they commonly will present to their primary care or family veterinarian first, at what level of care does the primary veterinarian care for those patients and then refer to you? And since you mentioned antimicrobial stewardship, what kinds of things could prevent some of the bacterial resistant infections?
Yeah, this is a really good question. So a lot of the cases I see have sometimes seen their primary care veterinarian like once or even a couple of times. And they're like, you know what? Your dog's still itchy. We're managing the infection. Or even sometimes the infection isn't being resolved initially. And they're like, you have to go see dermatology. Other times I've seen patients where people have done like a fabulous job. Like, I am so lucky to be in an area where I have like a great group of referring veterinarians. They do a really good job of working up these skin patients before I see them. Even a lot of times like doing their deep skin scrapings and superficial skin scrapings to look for mites, checking for fleas, making sure they're on really good parasite prevention. But I really view the primary care veterinarian as sort of like I'm an extension of their care. Like, I'm really there to sort of help guide this pet family and that pet through their journey with their skin issue. And really their primary care veterinarian is there to help them with literally everything else. Dental disease, joint disease, vomiting, diarrhea, and then things that people can do to try to help reduce antibiotic resistance. I think there's this huge shift in veterinary dermatology towards treating superficial skin infections. And they're like the type of skin infections where there's hair loss, crusting, or papules, which are like little pimples on the skin topically. If it's local, it's just one small area. We have lots of different wipes or mousses that we can use, medicated shampoos. And if it's really not getting better with those things, then we need a bacterial culture. And there's even the shift in terms of like doing bacterial cultures even earlier than we ever did them before to help kind of, choose our antibiotic to make sure it's sensitive on the culture. So bacterial cultures of the skin are really important to help us too.
You mentioned fleas, and I'm going to assume in South Florida you see a lot of fleas. What role do fleas play in skin disease in dogs and cats?
Oh, they can play a big part of it. We do see a lot of flea allergy. And so flea prevention is very important in South Florida. Part of that is it's so hot. There's a ton of wildlife out there too. There's raccoons, there's squirrels, there's rodents, there's neighborhood kitties, and like flea eggs are dropping from their hair into the ground. And then your pet walks by when you're taking them for a walk. So we always try to make sure that they're on really good flea prevention. And the cool thing is a lot of our newer flea preventions off-label will also treat for things like mites too. So it's pretty cool. And so the flea allergy itself is actually an allergy to the flea saliva. So when the flea bites the pet, that's where they become allergic, or some pets are allergic to it, not every pet.
Does it take a lot of fleas or not many?
It doesn't take many at all. We always kind of say the old adage is it just takes one flea to cause flea allergy. The interesting thing I see is a lot of people get confused when they bring their pets in. If they have multiple pets in their household, only one of the pets might be itchy. And they're like, how could this be? All the pets, probably have fleas. And I'm like, well, that one pet probably is allergic to the flea saliva, whereas the other pets aren't allergic to it. Even though they're not allergic to it, though, we still have to treat for the fleas.
Even with pets that are all indoors?
Even pets. Oh my goodness. This is one of my favorite things. We have a lot of high-rise buildings in South Florida.
Right.
And so there are even pets on the 30th floor who I've seen who have had fleas. And what happens is even indoor cats, indoor-only cats, dogs who aren't on flea prevention are sort of walked down the hallway. Mm-hmm. Then flea eggs drop off. They can go, near the carpet, near the door. Vibrations, we're walking by, our vacuum, our kitty walks by, boom, that adult flea emerges from its pupal case and then can jump on your kitty and bite it. And then you think, why is my indoor only kitty itching? You don't even think of fleas because they're never outside. Absolutely.
It's a huge problem. And the good news is that we have so many preventives and treatments now than when I graduated from vet school many years ago. So it's an encouraging change.
It totally is. I think, and this is a really cool time in veterinary medicine too. We are getting all these new products, monoclonal antibody products, Cytopoint for itching. I mean, things that I don't really use a whole lot are, for joint issues like Silencia or Librela. But I think a lot of new medications to really help pets live even better lives.
So we've been talking about flea allergies, and actually I want to take a deeper dive into allergies right now. When people have allergies, they tend to have respiratory signs. So why do dogs and cats have skin signs with allergies?
It's a really good question. So a lot of pollen can be airborne. And I was really I think this is so interesting. Pollen can actually travel quite a distance, even up in the air or even for miles sometimes. So it's not even just the thing that is in someone's yard. It could be blocks or miles away, but people are inhaling those allergens and then they're causing respiratory signs. In our pets, they're hairy. So all this pollen is getting trapped in their hair. It's touching the skin. And then there are certain cells that actually can sample little pieces of allergen on the skin surface. And there's other things that are involved with allergies, like the skin barrier can be impaired. So our skin's normally soft and smooth, but there can be deficiencies in certain things in the skin, making those allergens more likely to penetrate the skin. And then there are those cells sort of present that piece of allergen to the rest of the immune system. And then the immune system decides whether it's going to react or not. And if it sounds like the alarm bells, then there you go with all these cytokines and all these different molecules and things that are released that create itching and inflammation, then it can lead to infections. It's just literally this cascade of things that can happen.
So we've talked about fleas and talked about pollen. Are there other things that can cause allergies with skin manifestations?
There can be. So other environmental allergens, dust mites, storage mites. Dogs can even be allergic to cats, or cats can be allergic to dogs or other animals from the skin cells that are actually like shed off of them.
Wow. Okay.
So there's many different things. And a lot of people like dust mites and storage mites can be in the cleanest of houses. They're in the cushions, they're in the rug. So you can't completely clean them out of the environment. So I usually say like we allergy test for things that like you can't remove from the environment. And so that's why we need to use immunotherapy to try to help get your pet used to this stuff over time.
So is an allergy ever cured, or is it just managed? And how do you manage it?
Yeah, that's a great question. Allergies cannot be cured. I think it's a really tough thing. A lot of people come and see me and they're like, you mean like it can't cure them? And I'm like, no, but our goal is to manage them. And there are lots of different ways that we can manage them. One is, even though the infection is secondary to the allergy, we still have to treat the infections as they come. I usually say it's best to try to manage the underlying allergy as early as possible in that pet's life, because we know that sometimes pets' allergies can get worse over time. Even seasonal allergies, their season can get longer, and then sometimes it becomes all year round.
So you have allergies that will occur just occasionally and others that occur all the time.
Definitely. So like seasonal allergens would be much more like environmental allergens, some pollen blooming during that time of the year. Non-seasonal allergies could still be pollen. Like there's some thoughts now that like in our area where things are blooming all the time, that literally dogs could be allergic to something all the time of the year that's blooming. The other side of non-seasonal allergies, the all year round allergies, is it could be environmental or it could be food allergies.
Oh, okay.
And so food allergies are usually due to the protein source in the food. And because you're feeding the same proteins all the time, the dog or cat is having these issues all the time. Honestly, I usually say that, besides flea allergy, food allergies are the best allergies to have because you can control what goes into your pet's mouth.
Yep, absolutely. But they're not easy to diagnose any of these things. So walk me through a diagnostic plan for a pet when you suspect that there's an allergic cause.
Definitely. This is actually, I literally had a case like this morning. Her name was Sophie.
Oh.
She's a middle-aged golden doodle.
Okay.
And so it really, the history can give us a lot of good information too. Sophie's family gave her some cooked chicken a few days ago, and normally she eats beef and she's been much more itchy. But sometimes it's not as easy as that. So usually I'll start with ruling out the easy stuff, like get out the flea comb, do some skin scrapings, make sure that there isn't something else that's going on besides allergies. And then when we find, hey, there's no mites, they're actually on really good flea prevention, there's no fleas, sometimes we'll do a ringworm culture if there's no ringworm. Then we're like, you know what? We think this is allergies. And you're right. Like we can't look at a dog and tell if it's food or environmental allergies. We need diagnostic tests. And so the first test for food allergy is really a diet trial. And we're not talking like just changing the diet to another over-the-counter diet. We're talking about like prescription diets or home cooked diets with a new protein that your pet has never eaten before, or what we call like a hydrolyzed protein, where the pieces of that protein have been broken up into like the teeniest, tiniest pieces, like kilodalton sizes, to try to prevent the immune system from reacting to it. And that diet trial has to be like very strict for 2 months. Now, I will tell you, I have had to do it my own dog. And I love training with my dog. We do a lot of training. And I always used to think, oh, thank gosh, I don't have to do a diet trial on my dog. Well, when you do, you actually realize there's so many more options for treats and things, but it can still be on the diet trial. If they don't improve, and we're really looking for at least like 50% improvement on the diet trial, then we know that dog has environmental allergies. Environmental allergies are a little bit more challenging because we can't really have control over the big, wide environment, but we can do things like environmental allergy testing, skin testing, where we give a little bit of sedation, trim a little bit of hair, and inject different allergens into the skin and see what your pet reacts to. Now, that's only the first part. The second part is we then create this custom-made vaccine for your pet to try to get their body used to this stuff over time. And that's not really fast either. Like that can take 6 to 12 months to see improvement. And we really do it for a year. And so we still sort of may need some other medications to like keep your pet comfortable during that time. But ultimately, about 2/3 of pets, it can improve their symptoms by at least about like 50% or more. If it's helpful at a year, we give it lifelong. And if it's, not helpful, if your dog's in that 1/3 of dogs where it's really not helpful, then we stop it.
Wow, your clients must be really committed to doing all of these things because it's a long process, isn't it?
It is totally a process. I usually like to think of allergies and skin diseases as a journey. We start with the easy things and sort of like work up from there. And so it's sort of like, it's setting expectations too, right? Like some people, they come in and they're like, I want to know exactly what it is right now. We have to say, you know what? It's going to take a little bit of time to try to figure this out. But if we follow the process, then we can tell if your pet's allergic to food allergies, environmental allergies, or even both.
So you mentioned this a little bit earlier with the new medications available. And when I first started in veterinary medicine, which has been some 30 years ago, veterinarians commonly gave corticosteroids to control itchiness. What are some of the newer tools veterinarians have to control itchiness while working on long-term allergy management solutions?
So we have Apoquel and Cytopoint, and these are two medications that work on the same overall itch pathway called the IL-31 pathway. Okay. And IL-31 is this cytokine that then binds to its receptor, and the initial part is sort of like the JAK-STAT pathway. Apoquel works by inhibiting that JAK-STAT pathway, and so that inhibits the itch signal from going along the nerves to the brain. Cytopoint actually works a little bit differently. It's a monoclonal antibody. So we normally have lots of different antibodies in our body circulating all the time. But this is where we're taking an antibody specifically for that IL-31 and we're injecting it into that dog and it's circulating and it's binding to that IL-31. Okay. And so both do prevent the itching. They just prevent sort of that itch signal from being passed along the nerves to the brain. So dogs are still itchy. They just don't really know that they're itchy, which I think is kind of interesting. But those medications tend to have less side effects than, like you mentioned, steroids that we still sometimes use in these really severely inflamed dogs. But a lot of times we can use these safer medications, Cytopoint and Apoquel, to help us manage itching in these pets.
So in addition to some of the medications that you've talked about, what are some other long-term management solutions to keep pets happy and comfortable? And what if there's just a mild allergy? How do clients prevent that from getting worse?
If it's a mild allergy, I always think about, wow, just like even giving your dog a bath to help rinse allergens off the skin can definitely be helpful. And there's so many different types of shampoos, like anti-itch shampoos, antibacterial shampoos, depending on like exactly what that pet needs help with. Even like fish oil supplements sometimes can be helpful for the skin, but really early management for sure. Trying to prevent that inflammation from getting worse over time. And if you do notice it getting worse, then we need to go into that like allergy workup that we talked about.
Excellent. And should people talk with their primary care veterinarian to make sure that they're getting the right products for what their pets need?
Definitely. There's so many different products out there that your primary care veterinarian can really guide you into what your pet needs, like anti-itch shampoo. Does it need something for dry skin? There's conditioners to help improve the skin barrier. There's even other products like spot-ons that can help improve the skin barrier. And your primary care doctor should be your first line for this for sure.
Well, Melanie, it has been an absolute delight to speak with you, and we're nearing the end of our time together. In closing, what's your biggest recommendation for pet owners who are managing allergic skin disease?
I think it's that don't give up. There's a lot of different pets out there and people who are experiencing the same thing that you are, and that it is truly a process. And, every pet is different. Sometimes allergies are managed much more quickly. Sometimes it takes a whole lot more time, but know that there's your primary care veterinarian and veterinary dermatologists out there to really help guide you in this lifelong journey.
Well, I certainly appreciate this time. I know that you're super busy in practice and life and everything that you have to do. So thank you so much for carving out some time to speak with me.
Thank you, Marie.
Thank you for listening to today's episode. We hope you enjoyed it and learned a few helpful tips. If you haven't already, I encourage you to subscribe and listen to our previous episodes to hear the many valuable insights and lessons from our past guests. Don't forget to leave a review for today's episode and share with friends. Make sure to follow VCA Animal Hospitals on LinkedIn, Facebook, and Instagram to stay in the loop. For more inspiring stories, visit our website at vcavoice.com.